it's not like this guy was the CEO of Kaiser Permanente and he was on the Affordable Care Bronze plan. It's not like he was waiting in line at the clinic on the corner in some rundown neighborhood. So the CEO of Kaiser Permanente passed away last night. Bernard Tyson died unexpectedly at the age of 60 years old in his sleep, which is very sad. It's very unfortunate. You never want to see anybody who, who has achieved as much as this guy's achieved and seems to have done as much good as he is being reported to have done, to die like that, to die completely unexpectedly at the age of 60 in your sleep. And we don't really know what the cause of death was because it's too soon for an autopsy. But the first thing I think a lot of times when I see a story like this is maybe pharmaceuticals, maybe drugs of some sort. You do have freakish deaths like this of people just randomly passing away, while they're sleeping. I don't know what Bernard Tyson's health history was. There's nothing really online as far as, did this guy have heart disease? Did he have diabetes? Didn't seem to have cancer, especially if you die unexpectedly. And I'm not here to talk bad about the dead. The guy deserves to rest in peace like anybody else. But I do have a lot of questions when it comes to the fact that as the CEO of one of the biggest health plans in the country, you have access to the best health care, better than anybody else in the country. It's not like this guy was the CEO of Kaiser Permanente and he was on the Affordable Care Bronze plan. It's not like he was waiting in line at the clinic, on the corner in some rundown neighborhood. I mean, he most likely had access to the best care available, and still that wasn't enough to keep this guy alive. Or maybe, if it was a complication with a pharmaceutical, maybe it was too good of a medication. And that's an issue that we see a lot with pharmaceuticals. Of course, this is all just speculation and who knows, but before this happened, I didn't know much about this guy, Bernard Tyson. I didn't know much about Kaiser Permanente, but I learned a lot. And I'd like to go through a couple articles to show you exactly what I'm talking about, especially the intersection of Bernard Tyson's philosophy on healthcare and what is really happening at Kaiser Permanente right now. So the things that you would hear this guy Bernard Tyson say and his beliefs and the things that he would preach and what he would tell people about the direction that Kaiser's going in, and then what's really happening on the ground and how the two kind of really don't fit very well together. So let me go through this article in Reuters and you'll see what I'm talking about. So Kaiser Permanente CEO Bernard Tyson dies unexpectedly at 60. Bernard J. Tyson, chairman and chief executive officer of non-for-profit health insurer Kaiser Permanente, died unexpectedly in his sleep on Sunday, age 60, the company said in a statement. Tyson, who held the job since 2013, was Oakland, California-based Kaiser Permanente's first black chief executive and a strong proponent for affordable and accessible health care. The company did not give a cause of death. A company spokesperson did not immediately respond to a request for comment. A day earlier on Sunday, the San Francisco native took to Twitter to post about high-tech and high-touch healthcare. Tyson was described by colleagues in a company statement as an outstanding leader, visionary, and champion for high-quality, affordable healthcare for all Americans. In response to Tyson's death, the National Union of Healthcare Workers postponed a 5-day strike by 4,000 mental health professionals that had been set to begin on Monday at more than 100 Kaiser clinics in California. I didn't know before I read this article that there was a protest by 4,000 Kaiser Permanente mental health workers. Apparently, what's going on there is the Kaiser Permanente mental health workers were planning a 5-day strike to actually start today. They are striking because they're saying that plans are underfunded. They're saying that mental health workers don't have enough time to spend with patients. They're finding that the care has been very inadequate. A lot has been put into the fact that there seems to be very long wait times for patients to get care. And if you've been keeping up with the news of things going on in California, it's no surprise you get mental health catastrophe. You got homeless problems now in San Francisco and Los Angeles. And it seems to be that the Kaiser Permanente mental health workers are, they're sick of it. They're sick of it. They're like, hey, we're trying to provide this level of care and we don't have any support coming from the big dogs, Kaiser Permanente, which is shocking because Kaiser Permanente, under the leadership of Bernard Tyson, has actually grown quite a bit. You see here back in this article that Kaiser's annual operating revenue as of June was nearly $80 billion, which was up from $53 billion in 2013 when Tyson took over as CEO, according to the company's website. So that's pretty amazing. I mean, since Bernard Tyson has been CEO of Kaiser Permanente, they have grown in net revenue or operating revenue by, I'm going to guess, about 75%, which is pretty amazing as a healthcare plan, for a nonprofit healthcare plan, that they have been able to make that much money. Now, I know there's a lot of complicated factors that go into that number, right? I'm not going to sit here and, do this social justice warrior thing when I go, look, it's just another example of a big evil insurance company making money off the backs of Americans, blah. But what I am going to say is this is an example of why people can directly point to the fact that something like the Affordable Health Care Plan or the Affordable Health Care Act, or the Affordable Care Act, Obamacare, has been a complete failure because right now you have 4,000 mental health workers who work for Kaiser Permanente who are basically saying that they're completely underfunded, they're completely undermanned, they need more workers because of the low level of care they're able to give people, because of the long wait times, yet in only 6 years, Kaiser has $27 billion more than it did when Bernard Tyson took over. So, so what does this say? What does this say? Money and healthcare, they don't add up. They don't add up. When you look at the fact that Bernard Tyson dies in his sleep at 60 years old, which is way too young for a person who should have the best healthcare you could possibly get, that's too young for somebody to pass away like that. And the crazy thing is Bernard Tyson, what people loved about him was that he was very outspoken about a very holistic, health care oriented way of doing business. It's actually encouraging when I watch speeches by this guy, and he was talking about how health is not just determinant of your genes, but your genes, your environment, the foods you eat, that there's so much that we don't know about mental health, but yet the service of mental health that we give people is so inadequate because the problem with mental health is we just treat the symptom, but really mental health is an issue of the mind and the body. And you could see within Kaiser's system that they were trying to implement this more alternative care, holistic care, that they are trying to make it a point of their service to introduce education to clients, which is I think is a great thing. You don't see that in a lot of insurance companies. But then you actually look at the facts of what's going on. The company grew 75% in 6 years during this time of the Affordable Care Act. Now, I don't know enough about Kaiser's business model or their business dealings or their funding to comment for sure on, what kind of shenanigans is going on within that company. But, there are a lot of, message boards out there, and there's a lot of information that points to, a lot of issues within Kaiser's actual practices, doctors being sued for malpractice, Kaiser being real bad about reimbursement payments, about paying both providers and patients, covering patients' claims, like any insurance company is. I just find it so hard to believe that for a guy who was so hellbent on changing and innovating within the healthcare industry and bringing all of these new concepts and really trying to take the technology side of Kaiser's service to the next level. But his own health could not be saved from lack of healthcare, even though he had enough healthcare that should have been able to at least help him deal with whatever health issues he was dealing with. I mean, if you're looking for a failure of the healthcare system, I mean, look no further than this story. It's all right here. When the CEO of one of the biggest health plans in the country passes away completely unexpectedly in his sleep, most likely due to health complications, pair that with the fact that because of that happening, a protest of Kaiser's mental health department had to be called off, but is still going to happen, says a lot about, well, what is going on with these big insurance companies? Maybe when a company grows 75% and still cannot offer quality service, that says a lot about the failure of how these insurance companies are actually run. So again, I'm not here to disparage, this guy, Bernard Tyson. Sounds like he was a very innovative guy. If you're a numbers person, you could see by the fact that Kaiser grew so much that he was a great businessman and he did a lot of very good, innovative things to help grow the health plan. But maybe in the end, that's the problem with the health insurance industry, is the fact that some of these health plans just get too big that the actual quality of service just is completely inadequate when the numbers start to get as big as they do. But I'd love to know what you think. Let me know down in the comments what you think about Kaiser Permanente, what you think about big health insurance companies, and what you think about the fact that maybe as the healthcare system gets more innovative, could it potentially be that the overall health outcomes are not correlating to that positive growth? Let me know what you think down in the comments. Also, if you enjoyed the video, please give me a big thumbs up, subscribe to the channel, and make sure you share this on all your social mediums. Catch me on social media, and I'll catch you on the next video. Thanks so much for watching, everybody. Peace.